So good afternoon, everybody. We're here today to provide an update on testing, on personal protective equipment, hospital capacity, as well as an update on our plans to support the Commonwealth's shelter community and homeless population. We'll also make an announcement around additional support for foster parents. Yesterday, we had a really strong day when it comes to testing, with 8,750 tests conducted and processed. That's the largest number on any single day. That brings us to a total of 140,773 tests conducted in the Commonwealth and maintains our status as one of the biggest testers on a per capita basis in the country. That's more than double the goal we set for ourselves a few weeks ago. Obviously, as we said back then, with more tests, we would see more positives. There were 2,263 new cases reported yesterday. We'll continue to chase personal protective equipment any way we can and are working hard to get PPE out to frontline workers who need it. And as of yesterday, we've delivered over 4 million pieces of PPE, which includes 2.3 million gloves, over 370,000 aircraft masks, almost 190,000 gowns, and 380 ventilators. There's more that needs to be done here, and we've talked about that a number of times. The command center is communicating daily with hospitals and medical professionals around the Commonwealth to monitor the capacity in our hospitals. And as of the end of yesterday, there are now 18,000 beds available statewide. About 10,260, or 57% of these beds, remain unoccupied and available for patients. These unoccupied beds include about 6,600 acute care or 9 ICU beds, approximately 2,600 ICU beds, and 900 beds at our field medical hospitals. As a reminder, the beds in these field medical hospitals are only intended to be used if they're needed and for patients who have something less than an acute care need. We anticipate that hospital rates will increase in the coming days, especially in our hospitals for patients that need COVID-19 related illnesses to be taken care of. We're seeing an increase in the number of people needing hospital-level care, and that is driven in many respects by COVID-19. There's a lot of hard work and good relationships between the command center and our healthcare community across the Commonwealth, and good plans in place to manage this surge. At this point in time, we believe we are doing all the things our medical community is looking for us to do, and that they are doing all the things that we're looking for them to do to keep up with the increase in hospitalization. And for now, we all feel in pretty good shape with respect to this, but that's because everybody's out in the community working hard and doing their job by socially isolating, by washing their hands, by wearing face coverings when they go out or end up in a place where they can't socially distance, and doing the things they need to do to slow the spread. And this is no time to let up. We're also getting daily data from our hospitals so we can keep an accurate inventory of the beds, and that allows us to continue to assess the Commonwealth's needs both statewide and regionally during the surge. I'm also pleased to announce that effective today, the Commonwealth will distribute respirator masks to all local law enforcement officers and firefighters statewide during the COVID-19 response. This includes sheriffs and university police. This has been made possible through some hard work from the COVID Command Center and the folks at MEMA. Starting today, nearly 200,000 masks will be distributed to all communities. MEMA will execute this task through their regional point of distribution model, where communities can pick up supplies at their designated MEMA point of distribution. This distribution is going on as we speak, and tens of thousands of masks have already been distributed to our first responders. MEMA's worked closely with them to determine how many masks each first responder needs. They've worked out a formula where each first responder will receive 5 masks, which is an equivalent to 1 month's supply plus a spare. Our first responders are trained on how and when to use these masks, including how to properly care for them. The new mask allocation is in addition to the ongoing PPE distribution by MEMA and DPH to hospitals, nursing homes, senior living communities, community health centers, local public safety, emergency management response, state agencies, and other organizations. As of yesterday, the Commonwealth, as I said, had delivered 4 million pieces of PPE statewide. Daily distribution of PPE can be found at mass.gov/COVID-19. I think everybody knows that the challenges of COVID-19 are being especially felt hard in some of our most vulnerable populations, including the homeless. For an estimated 18,000 Massachusetts residents that experience homelessness, COVID-19 is particularly challenging. Massachusetts was among the first states to create designated isolation sites for COVID-positive homeless individuals. This partnership between the state and our homeless shelters and municipalities has been underway for several weeks now. This includes expanded scattered sites for homeless family placements and the development of an expedited PPE distribution process for shelters. This strategy to support homeless individuals and families includes 5 key initiatives. First goal is to establish regional isolation and recovery sites for COVID-positive individuals. Between state and local efforts, we have over 1,450 beds across the Commonwealth currently available, with the capacity to add beds if we need to. MEMA opened 5 hotels across the state to provide a safe place for people experiencing homelessness so that they could isolate and recover if they've tested positive for COVID-19. These 5 hotels have 550 beds total and are staffed with 24/7 security and nursing staff. We've been working closely with numerous local health systems and community health centers to provide other on-site support services with physical and behavioral health professionals. We've also worked closely with the City of Boston, which has established the East Newton Pavilion and Boston Hope Medical Center location sites in partnership with us, the Boston Healthcare for the Homeless Program, Boston Medical Center, Partners Healthcare, and several other shelters. We are very grateful for the continued partnership we have with Mayor Walsh and the City of Boston to make these locations and services readily available. These 2 isolation sites in Boston have a total of 732 respite beds for homeless individuals who have suspected or confirmed COVID-19. We're also providing technical and logistical support to several municipalities that have established their own isolation solutions, including Chelsea and Revere. As of April 15th, over 160 individuals have been served at one of these sites. Our second goal is to deploy equipment and supplies for local quarantine solutions. We've created an expedited process for homeless shelters and municipalities to request equipment and supplies such as tents, beds, and portable showers. This equipment can be set up as quarantine solutions in places like repurposed school gyms, recreational centers, churches, office buildings, and heated tents. So far, 11 communities have received supplies from MEMA to support their quarantine efforts. These communities include Brockton, Cambridge, Fitchburg, Framingham, Greenfield, Hyannis, Lowell, Southbridge, Taunton, Worcester, and Waltham. We've developed an expedited process for homeless shelters to request PPE and other supplies necessary to maintain appropriate cleaning and sanitation practices in shelters for staff. And as of April 15th, 84 shelter sites have received a robust assortment of supplies from the command center, including masks, face shields, gloves, partitions, temperature strips, hand sanitizer, and cleaning supplies. Each isolation and recovery site is being equipped with sufficient PPE, medical supplies, food, toiletries, and other provisions for all guests, clinical staff, security, and first responders. Our third goal has been to support families in emergency assistance and domestic violence shelters. The Lieutenant Governor will have more to say on this in a few minutes. And lastly, we've been providing technical assistance to organizations and municipalities seeking funding through FEMA's Public Assistance Program. For municipalities and nonprofits, FEMA will reimburse 75% of the costs associated with qualifying quarantine and isolation services for people experiencing homelessness. We've also established a dedicated portal to support municipalities and organizations through the grant application process. As of April 15th, 236 applications have been processed and approved by MEMA, and the Command Center continues to work closely with homeless shelters and local municipalities and will update guidance and supports when appropriate. We're also taking a number of steps to support individuals in the Emergency Assistance Program. The Department of Housing and Community Development is in regular contact with shelter providers and has weekly calls with the community. DHCD has put out several pieces of guidance for shelters, including an emergency screening protocol for families with COVID-19, congregate screening protocols, and sharing information on COVID-19 from DPH and CDC guidance with families. We're implementing policies that will allow providers to spread people out more in shelters, and DHCD is working to bring more scattered site apartments online to help with this. We're also working to cut red tape and to give people more options for where they can stay without penalty. Now, if a family in an emergency assistance shelter wants to leave the shelter to go stay with friends or family during this crisis, they're able to do so, and they can return to the shelter later without penalty. We'll continue to remain in close contact with shelter providers to make sure they have the resources they need to keep the families within their communities safe. Today, we're also announcing some additional relief for the Commonwealth's foster parents. We know that, like most families in Massachusetts, as a result of school closings and work-from-home recommendations, foster families are incurring increased food, cleaning supply, and utility costs. Everybody knows that foster parents are vital to the Department of Children and Families and its mission to keep kids safe, and as they care for some of the Commonwealth's most vulnerable children who have been abused or neglected. To aid these foster parents who voluntarily care for our children, the department will be making a $100 per child per month reimbursement payment for the months of April, May, and June. Currently, on average, foster parents are reimbursed between $830 and $975 per child per month, depending upon the age of the child in their care. These $100 additional payments represent a 10 to 12% increase over current reimbursements for foster parents. The relief will benefit approximately 4,500 foster families who provide departmental foster care for about 6,700 children. This includes unrestricted and kinship foster families. We anticipate the first payments will be issued later this month. Right now, Massachusetts is going through the surge. We've talked about this before. Many people are sick and hospitalized as they fight this insidious disease. We're bringing every resource we can to the task and calling on our best and brightest here in Massachusetts to help us navigate these difficult waters. This pandemic has required significant sacrifice from us all. Closing businesses and schools, staying home, canceling family events like weddings and funerals, asking our first responders and frontline healthcare workers to go above and beyond to work extra hours and put themselves and their loved ones in harm's way. Yesterday, the President released a template for how the country can begin to think about reopening in a phased approach. The administration has rightly deferred to states to make the best decisions on behalf of their residents. And notably, before any state should consider efforts to slowly return to normal life, health experts urge states to look for infection rates and hospitalization to be on the decline for about 2 weeks. Here in Massachusetts, we're still seeing daily increases in positive cases and hospitalizations. And as I've said many times before, the surge arrives in different states and different regions of the United States at different times. Therefore, the process through which people will presume and move forward past the surge is going to vary depending upon when they actually see themselves in a situation where they see the kinds of declines that were talked about in the recommendations. We're working around the clock to expand our testing, to build a robust contact tracing network, and to get people well. And we're urging everyone at home to do your part and hang in there. We're also in discussion with other states and the business community to start building plans on how we can gradually and safely reopen the economy. In the meantime, please do your part and continue to abide by the many rules associated with social distance to stop the spread. Cover your face or wear a mask when you're out in public if you can't adequately social distance, because these things at the end of the day are the best tool we have to stop the virus and the spread. As your governor, I'm always going to put the needs of Massachusetts first. Working with other states is an important part of making sure that we understand what they're up to and they understand what we're up to, so that nobody gets surprised. And we'll continue to fight full force so that we can move back toward normalcy when it's appropriate to do so. There's no doubt we will recover and we will see brighter days. And the spirit of this great Commonwealth will not fade. And in fact, I'm pretty sure it will come back stronger than ever.